Hello and welcome, dear students. Today we are going to enlighten ourselves on the collaborative project Reflections on Pandemic, that is novel coronavirus COVID-19. This information has been released by the Awareness Center of the Ministry of Health and Prevention UAE. This information is shared for general public awareness. I'm sharing this with you so that you can collaborate with your wider community. You are expected to collaborate with uh, students of other schools or at national level students from other countries, and you are supposed to create awareness. And wherever you do not know something, you are supposed to find out, collaborate, discuss, and note down in your journal on reflections on pandemic. And occasionally you will be requested to submit your journals for evaluation. Now let us begin with the information that has been collected from the Ministry of Health and Prevention UAE website. What is novel coronavirus? COVID-19 novel coronavirus is a new strain of coronavirus which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases. First identified in a cluster with pneumonia symptoms in Wuhan city, Hubei province of China. Now, what are the symptoms of COVID-19? Let us find out. The most common symptoms of COVID-19 are fever, tiredness, dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, and diarrhea. These symptoms are usually mild and begin gradually. In one of the reports, it was mentioned that within the first 14 days of incubation period, the symptoms begin to show only after 5 days. Note that not everyone with a cold or upper respiratory symptom needs to get tested for COVID-19. Only a person with symptoms and travel history can do the test. Additionally, most people, about 80%, recover from the disease without needing special treatment. Please find out what happens to the remaining 20% and what are the reasons for that. How does COVID-19 spread? Novel coronavirus strains are spread from person to person through contaminated droplets. In technical terms, these are known as aerosols. Aerosols means are droplets. For example, when you use an air freshener, the droplets of air remain suspended in the air. These are droplets which contains millions and millions of coronavirus. Now let us continue. The droplets from person to person is sick with the illness through coughing or sneezing or contaminated hands. The virus can spread through touching an infected surface. Now, what will be an infected surface? For example, these aerosols which are in the air, if these settle down on any surface, it will become contaminated. People can also catch coronavirus COVID-19 if they breathe in droplets from the person with COVID-19 who coughs or exhales droplets. This is why it is important to stay more than 1 meter or 3 feet away from a person who is sick. Now, as we have resumed work and places are open, the distance is 2 meters distance that you need to maintain in a public place. Is there any treatment for COVID-19? The treatment of COVID-19 depends on enhancing the immunity level of patients, treating the symptoms, and easing complications. As there is no specific treatment for the virus to date. To date means this information was collected on 2nd of September from the website of Ministry of Health and Prevention UAE. What are the ways to prevent the disease? Washing hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. You need to wash your hands for at least 20 seconds, and there are steps to wash your hands that will come across that little later. Maintain at least 1 meter, that means 3 feet distance between yourself and anyone who is coughing or sneezing. This information is updated on their website time to time. The distance has been increased because we have resumed work. Coughing mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Avoid touching your eyes, nose, mouth without using your hands. You can use a mnemonic for remember. Jumble up these for the first, take the first letter M, E, N, and maybe you can remember men. So mouth, eyes, nose. You will remember not to touch with your hands which are contaminated. Avoid shaking hands with or and just wave. Now it is our culture to shake hands, but at present people will understand, they will not feel bad, so just wave. Avoid nose to nose greeting, hugging and kissing others. Avoid contact with animals, live or dead. Those who have pets, they need to be extra careful. There are municipal rules for pets. Please find out more about that and enlighten your collaborative group. What are the regulations regarding pets? You can find that from the Dubai municipality helpline or their website. Take enough rest and take a large amount of fluid. That means drinking lots and lots of water is advisable, and even vitamin C builds your immunity. That is ascorbic acid, which is present in orange and lemon. Procedures from those arriving to the UAE. Procedure for those arriving to the UAE. Now these are travel regulations or the procedures what to follow. Initially it was advised for 14 days quarantine, but now currently at the airport the CPR test is done at the airport. If you have any symptom of a respiratory infection and have traveled to any country with a widespread outbreak of COVID-19, over here V means Ministry of Health and Prevention UAE, advise you to do the following. Visit the nearest health center, hospital, and immediately inform the doctor of your recent travel history and other symptoms. But as I mentioned that now this test is being done at the airport itself. Follow the doctor's instruction, and if you were advised to self-isolate, please avoid any direct contact with people. What is the meaning of quarantine and what is the meaning of isolation? Please find out. Take the information from most reliable sources. That means do not forward any unknown or gossips through WhatsApp and emails. Always find out from the reliable sources. What are the reliable sources? Ministry of Health and Prevention has got its own helpline centers where people can dial up, call up and seek advice. And if you are doubtful during your project, you can also call up and find out more information. For any medical support or inquiry, please contact. Now these are the contact helplines. Istijaba, Service and Operations Center, Department of Health at 800-1717, Ministry of Health and Prevention at 800-11111, Dubai Health and Authority at 800-342. These are the inquiry lines. If you want to find out more information, they are more than happy to help you and guide you. Now guidelines for all, this was released by the Ministry of Health and Prevention as set of open data for public awareness. Your health is a priority, novel coronavirus COVID-19 community guide. Now this community guide I am sharing with you. You can make out, you can observe the different logos used over here. What does each mean? Try to find out. Now initially UAE, that was sanitizing the place and be at home, medical check, number of things were observed. Please find out what does each stand for. The students are requested to collaborate with family and friends and create awareness. What is novel coronavirus? I have already shared with you over here from where it had spread and how it is started. You can visit the Ministry of Health and Prevention website. They also have a YouTube channel, Ministry of Health and Prevention, that is MOHAP UAE. You can visit that, and there are quite a number of videos for students. There are interviews. Please go find out more during your project. The information is available in Arabic, English, Urdu, Farsi, that is Persian, and Chinese. Students are requested to enlighten their collaborative team members to visit the Ministry of Health and Prevention website, and I also mentioned Ministry of Health and Prevention UAE YouTube channel, and download the app from their website. Be aware, update yourself directly, spread the authentic word, avoid speculation. Speculation means you hear something and you begin talking about that with your family and friends and in your social circle. That is an irresponsible behavior. Wash your hands. This is the procedure of washing the hands. It is important to protect yourself from COVID-19 infection. That is, you need to wash your hands well and often, and this is the right way to do it. First of all, open the tap, rub your hands together, take soap, try taking an antiseptic soap or disinfecting soap, and rub your hands together, interlock your fingers, the front of the hands, then go up there, that is the back of the hands. You can see the front of the hands, figure number 4. Rub it for some time, interlock your fingers, clean in between your fingers, and then hold your thumb, screw your thumb in, out, clockwise, anti-clockwise. Then the back of your hands, the right hand, and then the left hand. Then interlock your fingers and rub your hand palm together, and then interlock your fingers front and back again, and then you can continue with your front and back of the hand. After figure number 8, open the tap again, wash your hands, and then dry your hands. You need to continue washing this for at least 20 seconds. Less than that will not help. Teach your collaborative group to wash their hands as guided by Ministry of Health and Prevention UAE. Now, raising awareness among children is an essential step in prevention. This video is present on the YouTube channel. Kindly go locate this video and watch it. It is an animated video for the students to create awareness. Advise your collaborative group to visit the YouTube and watch this video. Follow the advice, record this in your journal on reflections on pandemic. You will be requested to submit your journal work time to time. How is COVID-19 transmitted? I have already mentioned about that. It's a strain. It is spread through droplets, coughs and sneeze. Those are aerosols in the air, and through contaminated hands and surfaces. How can I get infected? How can I avoid getting infected? If you have sneezed or coughed, make sure that you wash your hands first, and then be aware that if you are in a surrounding where someone else is sneezing and coughing, you can get infected. Now, how to avoid getting infected? You can avoid getting infected. That means you should avoid touching your eyes, nose and mouth. It is the most important area through which the virus enters your body. Can I get sick from a person who is asymptomatic? Now find out the meaning of asymptomatic. What does it mean? The virus is transmitted mainly through the respiratory droplets that someone with COVID-19 secretes when coughing. The risk of getting COVID-19 disease is diminished when that person is asymptomatic. But many people with the disease show only slight symptoms. This is especially true in the early stages of the disease. Therefore, COVID-19 can be transmitted by a person who suffers from only a mild cough and does not feel ill. So be mindful of that. It does spread from people who might not show symptoms initially, and they will be the carriers and they can spread the disease. Guide your collaborative group regarding how the virus spreads. Find out the meaning of asymptomatic, discuss and record in your journal on reflections on pandemic. What are the symptoms if you get infected with COVID-19? This is very important for students to know. COVID-19 infects the lung. The incubation period lasts up to 14 days and it takes an average of 5 days for symptoms to appear. A high temperature, that is above 36 degrees centigrade, um, tiredness and a dry cough are the main symptoms. Now you may um, come across that when a person travels in the heat and he comes over and his temperature is checked, the body temperature is slightly higher. In that case, one person is supposed to take a rest for a while until the body cools down and then temperature is taken. And if the temperature is normal, 37 degrees 5, 36 degrees 5 centigrade, and then the person is considered normal. But if it is above, that means it rises by at least 0.5, then most probably the person is having fever. And additionally, when the leads to breathing difficulties. What do you mean by breathing difficulties, and why does this happen? What is the scientific reason of having breathing difficulties? Find out more about this, because right now we know it only in terms of words. What temperature is considered as fever? What is the normal temperature? Find out. How many degrees above the normal temperature is called fever? And if you know it in Fahrenheit, find out in Fahrenheit. If you know it in centigrades, find out in centigrades. Cough, difficulty in breathing. What do you mean by difficulty in breathing? Why does it happen? Discuss in your collaborative group what temperature is considered as fever. What do you understand by the difficulty in breathing? Why does it happen? Find out and record in your journal on reflections on pandemic. Who is at risk of developing severe illness? Now, while we are still learning about how COVID-19 affects people, older persons and persons with pre-existing medical conditions. Now, find out the age limit. What do you understand by older person? What age range is considered as older people? And people with pre-existing medical conditions such as high blood pressure, heart disease, lung disease, cancer and diabetes. Find out about each of these illnesses and why does it make them vulnerable, appear to develop more serious illness than others. Find out about each of these illnesses and how these people are more vulnerable. Is there any vaccine? Since the strand is new, the vaccine is not available at the moment. Explore why are certain people in the certain health conditions vulnerable or more likely to contracting the disease. Record your findings in your journal on reflections on pandemic. Protect yourself from novel coronavirus COVID-19. How to protect? There are 7 ways shown over here. I request you to pause the video and find out about these 7 ways and discuss in your collaborative group and record in your journal on reflections on pandemic. Wearing a mask. All members in the community now, please see that this information came out as early as April and it is present on the Ministry of Health and Prevention website. Encouraged to wear mask in public. Now it is a general norm that one has to exercise precautions, so one is supposed to wear a mask. First wash your hands, then hold the mask close to your mouth and chin. Pinch the nose piece over your nose and then fix the mask using the strips behind the head and looping behind the ears. Make sure the mask covers the mouth, nose and chin. Remove the mask without touching the outer surface and dispose in the trash. These are the procedures you are supposed to follow. Please make a note of it. This poster came out on 5th of April. The guidelines were issued at that particular time. And the mask is just one-time use mask. You have to use and throw. Discuss in your collaborative group how to wear the mask. Discuss the do's and don'ts of wearing. That means certain people pull it down to their chin. Chin is the most vulnerable part to connect collect the virus, and then when you wear it, you are wearing it very close to your eyes and nose, and most probably you may contract if you are not practicing the guidelines of wearing a mask carefully. So find out what are the do's and don'ts, discuss, record in your journal on reflections on pandemic. Cleaning and disinfecting your home. First of all, find out what detergents and what is advisable to be used. Do you use aromatic kind of liquids for cleaning and you call it disinfected? Please enlighten yourself on that. First, find out what should be used for disinfecting and what all surfaces are to be disinfected. For example, phones, computer, remote control, these are common areas. Bank cards, children's toys, hairbrushes, spectacles and sunglasses, interiors of your car, door handles. Discuss in your group and find out about the surfaces, and also find out about the cleaning reagents or the liquids to be used. What causes, what cleans and what doesn't clean. We are talking about disinfecting, we are not talking about cleaning. So please find out in terms of disinfecting. Why staying at home can stop the virus. This was during the lockdown, this information came out. So find out how it was used and how it prevented the virus from spreading. Also find out from where does the ministry get this piece of information, what research is used to practice and take an informed decision. You may call up the call center of Ministry of Health and Prevention and find additional information for your research work and your recordings. Effective social and physical distance, stay at home, work from home. This was earlier. Certain information is dated only at that particular time, March, April, May, June. That was the time it was advised to stay at home, work from home. But then by the end of July and August, by the end of August, work resumed, and then the certain things are timely, certain things are continuing. Now what is continuing? No handshakes and no hugs. That is continuing. No social gatherings. That is of course continuing, and certain distance to be maintained. That is continuing. Limit visit to grocery and pharmacies. That was previously advised. Now does it continue or not? Find out whether it is advisable to practice that, or one can continue with wearing mask and gloves. Discuss in your collaborative group what precautions practiced during the lockdown, what were the benefits, and in addition to it, find out the precautions that those are continued to be practiced and what were the reasons. Record your findings in your journal on reflections on pandemic. Staying healthy and happy at home. Find out a little more about this. That means how can you boost your immune system? What should you take? Other than myths, if you're not sure, call up the call center of Ministry of Health and Prevention during your project and find out, discuss in your collaborative group and enlighten others also, because this information will definitely help everyone to develop their immunity. Keep children and domestic helpers informed about the preventive measures against the novel. Why domestic helpers and workmates? Why should you inform them? There's a reason. Please find out, record that reason, discuss that. Remember to wash your hands after receiving home deliveries and get rid of packaging. Why is it important to get rid of the packaging? Why is it? Why does it make prone to contracting the disease? Provide liquid soap and hand sanitizers throughout the house. Why is it important? Why not have it in one place? Avoid social gatherings and rather chat via smart apps. Discuss all these things in your collaborative groups. Why should you destroy the shopping bags and for the packaging? And what are the precautions you should take while receiving the delivery? Find out and record in your journal. There are certain helpline numbers or for the call centers that you can find out, call up and find out. The one is of Ministry of Health and Prevention, one is of Medical Operations Command Center, one is Dubai Health Authority. During your project, you can seek help from them, and this information they time to time they are sharing on their Facebook and YouTube, Twitter, and, LinkedIn and Instagram. Be aware of the above information centers and find out what work do they do and will they be helpful in your collaborative project. Find out and share your findings with your classmates, but your collaborative group should definitely be from your own social circle. It can be from your family in the UAE and back home in India and other countries. Please develop this collaborative group for creating awareness. Use the information released by the Ministry of Health and Prevention UAE and spread the word. If you are new on the channel, kindly subscribe to this channel and hit the notification bell so that you get receive the notification when I upload the next video in this series. This is part 1, and hit like so that it gets added up in your auto generated like videos. You can refer this video when during throughout your project and share it with family and friends, especially those with your collaborative groups. Ask your collaborative group also to join the channel to receive the first-hand information collected from the Ministry of Health and Prevention website UAE. Thank you for joining me.